When we look at the intake, we have to understand the referral and what the purpose is of the test. So what does the referring provider want out of this test? Any occupation, own occupation, important to understand. You need a full medical review. They need to provide a full medical history because that may impact the components of the test and the outcomes as well. If you're looking at the specific job, you need a job description. Otherwise, you have no idea how to accurately identify what the patient does. You may be able to get a report from the patient, but having a job description is the best resource that you can utilize in those activities. We also want to determine the cardiovascular stability. We need resting heart rate and blood pressure. If that's too high, it may not be appropriate to conduct this test because you may be causing other issues for the patient throughout the test, as it's a physically dependent test. So as we go on to the next stage of the test, we're looking at musculoskeletal screens. So range of motion testing may impact their ability to lift or bend if they have limitations in any of those areas. Again, manual muscle testing too. If they can't lift their arm up and they're super weak, they may not have a decreased ability to lift a box or push a sled. Gait mechanics are important to identify how it is to start and then potentially if it changes. And then any sort of special test. If you want to do joint-specific testing or neural tension tests as well to identify if there are any other back issues going on, that may be appropriate as well. Some of those sections are up to the clinician's discretion, which you may be able to use and implement at however you want.